Hi, my name is Dr. Manuel Correia. I'm the medical director and co-owner of Blurred Lines Med Spa in Dartmouth, Massachusetts. Today we're going to be performing a Morpheus8 procedure for the face and neck for our patient. We're going to be using only a topical for this particular procedure. Only topical use is pretty common. Most places, when you have Morpheus done, will only use this lidocaine, tetracaine mixture in order to provide pain management. And we're going to apply that. So our patient has had this procedure with me 3 times. She has had it with full pain management at our facility. She has agreed to do this procedure only with topical at this time, just to have a comparative as to the treatment as typically done versus how we typically do it. And she would be a great candidate to give us the difference because she's had both. So we're going to apply this topical to the face. We usually leave it on for about 45 minutes. Again, it's a lidocaine 23% with tetracaine 7%. And it's great to provide anesthesia to the superficial skin area. And we leave it on there for 45 minutes. And then we commence with the procedure. We'll typically use about 4 grams for the face. It is a great tool to help provide for pain management. Certainly not the only tool we use. Feels all right. Okay. So we've again performed 3 procedures of Morpheus8 for our patient, and she's had results that have been quite outstanding. It has taken us about 3 months to start seeing some very dramatic results. Currently, this is going to be her 4th Morpheus treatment. We typically do 3. That's what we typically suggest. Again, we're doing a 4th to do a comparative between pain-managed Morpheus and just topical Morpheus. And then when I talk about pain management, what we have done with Tani in the past is we have used not only the topical, but we did nerve blocks in her face. Basically, they're infraorbital nerve blocks where we go up through the mouth and inject these 2 nerves. So Tani has had 3 treatments with the Morpheus8 with us here at Blurred Lines over the last 2 months. The areas that she was addressing are some of the jowled regions that were in this area here. The marionette lines, some of the lip lines that she had. We can see a nice tightening of that area. A lot of the pores have tightened up nicely. She's got firmness of the cheeks that you can see here. The areas under the eyes have firmed up where we've had an improvement in the area where she had some bagging underneath the eye region. We've also sharpened that jawline and have improved the subsegmental area under the chin and tightened up some of the laxity that she had there. She also had some lines on the nose, and we did use the Morpheus to help reformat some of those lines, and she's had a nice outcome overall. So the physiology behind how Morpheus8 delivers these results is through microneedling in combination with radiofrequency. So what the microneedles do is they penetrate the skin level, and we do so at various levels. We go down as deep as 4 millimeters, then we go to 3, 2, and 1 millimeter. So we address different areas of the dermal layers. We essentially ablate or destroy older foundations so that the body can recreate new foundations. And that's how we start getting the tightening, the new development of elastin and collagen that firms up the skin and gives it that youthful look. The amount of energy that's required depends on which portion of the face that you're working on. Deeper structures where you're trying to get more contouring and eliminate some of the fat, you're going to have higher energy levels. Some of the areas where you're just trying to affect some of the textural portion of the skin, you use lower energy levels for. We do even have a device that's called a resurfacer that goes as superficial as a 0.5 millimeter. The physiology, again, behind the Morpheus is that we ablate and get rid of the old layers and allow the body to develop these new layers over the course of time. It takes several months to start seeing some of these results roll in, but they're your own results. It's your own skin. It's very natural looking because, again, it's your own body that's reformatting its own skin. Again, after I would say about 2 to 3 months, people do start to notice significant changes not only in the texture but also some of the laxity and some of the wrinkles that are being treated with the Morpheus8. Another area that people call and look to get treated are under the eyes. People refer to these as eye bags. The laxity that's under the eyes is a common feature that a lot of folks try to address. Morpheus8 is a perfect way to do so. Morpheus8 works in several ways. It helps to tighten the skin that's under that area. It retextures that area so that you don't get that crepiness under the eye. And it does help to contour a bit. If there is some fat under that eye, we can contour some of that in order to smoothen out that appearance. The area under the eye, again, is very susceptible to appearing saggy. And when you improve and tighten that region, it makes a marked change in the facial structure itself. So I know that the under eyes is another area that bothered you that you wanted to address with the Morpheus8. Can you tell me what bothered you about the eyes themselves?
Well, they were starting to get really puffy, and it's the first thing you notice in the morning when you wake up. Mm-hmm. You look as though you didn't sleep, but then it never goes away.
Like a tired look.
Yeah, like a tired look.
Right.
And it catches the shadows, when those puffy eyes. So when someone takes a picture of you, it makes it stand out when your eyes are puffy because it puts shadows on your face that wouldn't normally have been there. And
right.
It's just...
So the way we address those shadows that Tanya is referring to is by using the Morpheus8 to reformat the skin underneath the eyes. It helps to tighten the pores. It helps to create elastin and collagen in that region to really firm it up so that when light shines in that area, you don't see that line that gives you that tired look. Again, we're not talking about big changes. These are subtle changes, but they are dramatic changes. And it makes you feel more youthful, and it allows you to look in the mirror and not feel or look tired. Alright, so we're going to clean some of the topical off here, and we're going to start on the neck. So we've allowed the topical to stay on for 50 minutes exactly. And we're going to go ahead and get started with the procedure. So this is the first time that Tanya has done this with just the topical. And we're going to do some test doses here, okay? Just let me know how you do. Okay. All right, ready? We're going to start with the 4s real quick. How you doing? Okay. How you doing? All right. Okay. So I'm going to go ahead and get started here. I'm just going to change this into a cycle mode.
Yeah, you can feel the electricity and the.
More so than when you had like the full third.
Absolutely,
area.
yeah.
So you like how we do it?
Absolutely.
Okay. Okay, so we're going to go to 2. The 2mm ones, again, you might feel a little hotter, but we do bring the energy levels down as we get closer to the skin, so there's a little trade-off there. How you doing?
Okay.
Okay, so I'm going to do some test doses here. Let's see. How you doing? All right. Okay. Different.
Yes, I can feel it now where I really couldn't feel it before in my face.
Yeah, I think the biggest pain reliever that we have is that nerve block.
Yeah.
So I think the nerve block really works well to just completely knock out that area. You're getting a quick treatment, by the way. It looks great. Okay. So this is the area that we really want to work. Well, this is the area that we have worked on her before. So this region just behind the marionette, really do a little bit of contouring in that. And what that does is it really helps to sharpen up that jawline, and it takes a lot of pressure off of the lines that are in what people would call the marionette line region. Again, I love using this procedure in order to treat it. I think it works really well. You can use dermals. I'm not a big fan of dermals for marionette lines because I think that fixing volume with volume is very difficult. I love using dermals. I love them on the cheeks to add volume. I love using the dermals in some of the nasal fold areas when required. I don't think it's really great for the marionette lines. I think the lines around the mouth, it could look a little funny when you start to fill those up with the dermals because it starts to kind of look funny. It bunches up. Some folks will refer to it as the Homer Simpson look, where it just kind of like bulges out and kind of builds up. So what I love about the Morpheus for the mouth is you get to get restructuring of those lines and start, from scratch. You essentially have the body reformat that skin, and it's, again, all your own skin. And there's no bunching up. If anything, we're probably taking a little volume off, as we do when we contour. I think this is fantastic for the nasal folds. Not that Tanya had bad nasal folds to begin with, but I do think they look tighter than ever. I do like, again, some of the textural changes to her skin. The pore sizes, when you look up the pore sizes on the side-by-side photos, you see how tight they have become. Those small micro changes are what really give us these large dramatic outcomes. Are you going to tell me that? Sorry.
No, it's okay.
It's an experience.
It's an experience.
So as far as when you're doing the markers, I think it's important to know what location you're in and your depth sizes. You don't really want to take away volume from areas that need them, like the high cheeks. But you do want to detract from areas like the jowled areas in order to give the face that nice slick look. Like that. You're a pro at this. Okay, that's good. That's good. Perfect. So we're going to go to the 3s.
It's nowhere near as comfortable.
I mean, it's not the worst thing in the world.
It's not horrible, but it was.
It was almost enjoyable.
I was trying to say it was almost enjoyable. It's not now.
Yeah. I mean, most folks would probably tolerate this, but not look forward to Before, you look pretty happy to walk through the door to do them. So, all right. So we're gonna get started on this. And again, I think it's hard to it's hard to compare the two because in one case we're just knocking out the nerve altogether. So it really isn't a fair comparison. So
I know some people that wouldn't tolerate this.
yeah. What would you grade your pain tolerance at?
It's different on the different parts of the face that you hit.
No, I mean
Sure.
overall, what would you consider yourself a high pain tolerance?
Oh yeah, I'm a very high pain tolerance.
So you can usually handle a fair amount of discomfort.
Yes.
So what would you grade this on a scale of 1 to 10 right now as we're doing this?
Maybe a 4 or 5.
Okay. What would you have graded it compared to before?
Compared to a 2 or 3.
2 or 3.
I mean, the third Morpheus session, I barely felt it. I literally barely felt it. I think the only time I felt it was when you hit the nerve in my neck. And I had when the electricity touches the nerve.
Right.
And it wasn't painful either, it was just a little jump.
Right. Anything with me? But I guess given the choice, pain management wise.
Absolutely.
Yeah.
I think the first time I was nervous, the second time I knew it was no big deal, and the third time I'm like, oh, this is a breeze. But I think if I had to do it, there would be some anxiety.
As far as what?
If I knew I was coming to do this again and now I know without the pain medicine, now I know how it feels.
Right.
I'd have to psych myself up to.
You seem to be tolerating it pretty well. But I think, like you said, you have a high pain tolerance, so.
It's not, well, that's like I said, it's not comfortable. I think if I had to do it this way again, I would definitely have to get myself prepared.
Yeah.
Where before I just came walking in.
Different experience altogether, though.
Yes.
I do want to work the eyes a bit here. You can get a little touch here. Okay, you're doing good so far.
Yeah,
Down to the 2s.
I don't remember those sharp, like, when I had the numbing.
You mean like with the nerve blocks and such? I think the laughing gas gets underrated too. I think there's a lot of, when you sway a little bit of that anxiety about everything, it just changes the whole scope of how you view the pain.
Absolutely.
Almost like you don't really care. It's like, something may hurt, but, who cares?
Yeah.
But,
Yeah.
Right? And so what song is that song? So, alright, so we're going to do the 2s, okay? If you need me to dial down, that's fine, but I think we're good so far. You're doing pretty good. You do have a high pain tolerance, that's awesome. But again, even without all that stuff, it's not like the worst procedure you.
No. Oh no.
So folks that are like afraid of doing the needles or don't want to do the other stuff, you can still do the procedure.
Oh yeah.
Yeah, and it's just, it might be a little more uncomfortable, but certainly not something that's...
That would chase them away. No, not at all. But it's just so much more pleasant.
When you have the mask.
Yeah.
Hey Raj, I'm having an issue with exporting that file. I need 2 more minutes.
You're good. You are handling just like a champ, though. Not cracking as many jokes.
That laughing gas is fun.
That laughing gas is funny. I can tell the dumbest jokes in the world. You're like, oh my god, this guy's hysterical. And the nice thing about the laughing gas, did you feel sick afterwards at all?
Oh, nothing. And the minute you take it out of your mouth, that's it.
It's gone.
It's gone.
Yeah. You didn't have any issues driving home, obviously.
Nope.
It's
Nothing.
nice not having somebody have to pick you up after a procedure, I think.
Exactly. Yeah. I remember asking you that question
Yeah.
when I'm like, do I need somebody to give me a ride?
Like, nope. Out of your system. It takes about 7 minutes. That stuff gets out of your system. So I'm gonna hit the nose a bit. Really kind of work those lines. Perfect. Okay. So we're gonna go to the ones. These get a little hot. Yeah, here we go. Like, yeah, just like that.
That's what I'm trying to tell you. Before,
Yeah.
I barely felt it. Now I feel every single one. And it's like,
It's a different.
it's
yeah.
this constant jolt of electricity.
Oh, right.
And,
It's a pain in the ass.
yeah, it's a pain in the face. It's a pain in the, it's a pain in the.
So the way we do it, you like better.
Oh, absolutely.
Yeah.
Yeah, no, that's what I said. If this was the way I had to do it every time, I would have anxiety knowing that, I had to sit here for an hour.
Alright.
So, where I couldn't feel it before, I am definitely feeling it.
Like the heat?
Well, it's the, I don't know how you describe it, the needles.
Right. And
I
yeah.
did not feel them.
right, without the calories.
There we go. Needs to be sold legally.
Yeah. Alright, we're hanging in there, so finishing the twos. Just gonna hit the middle line like a couple more times. So.
Yeah, hit I bet you'd be hilarious at a nightclub.
Let me just hit this one. All right, Tanya, you have survived, and that is Morpheus topical only. So let me put some HA on you there. You gotta, I mean, I use the same energy levels, the same number of passes, so the same treatment, just a different experience. So. Do you have HA at home? If not, I'm going to give you a bottle.
I brought my bottle with me.
I'll fill it up for you. And you know the routine, right? So 48 hours, no makeup or anything. Send me a photo tomorrow. Just want to see how the skin is responding. It should respond the same, you know, whether you use numbing agents or not. That doesn't make a difference.
Right.
Only in the immediate phase.
Right.
I mean, this is the same treatment. It's just without all that other stuff.
Yeah, it's just, this is what I'm saying, I can feel, so I didn't usually start feeling this heat
Until after the numbing medicine wore off.
until after that all wore off, and so I'm feeling it right away now.
Yeah. Yeah, so, I mean, as far as the overall results that you're getting, what do you think?
Absolutely worth it.
Yeah.
I can't, from the person I was looking in the mirror at 4 months ago to the person I'm looking at now,
Big confidence booster, yeah.
confidence booster,
Right.
just amazing.
Yeah, yeah.
It's amazing.
And if you can get those results with less pain, why not?
Absolutely.
So, all right. Well, I appreciate you coming in and letting us do this little experiment. I think you're in a great position to kind of explain the difference because you've done both. So you did the procedure the way we typically do it with nerve blocks, with the tumescent injections, with the Pronox as well as the topical, and then kind of compared that to just the topical, which is where you, which is what most places offers is the topical. Again, not that there's anything wrong with just doing the topical, but if you had to pick one, you'd probably say
Absolutely. The nerve blockers.
and everything,
The tumescent.
right? The tumescent and
the
the
laughing gas.
laughing gas. All right,
And that's
Okay.
exactly what I'll be choosing when I come back from my yearly
Maintenance.
Maintenance.
Yeah. So with Morpheus8, we do we get awesome results. If you do nothing, they'll last probably 2 to 3 years, but you're not going to go back to where you were immediately. You're going to age from that time point. And what we offer in order to prevent some of that aging is a maintenance treatment, which we would recommend as once a year. Do that for about 6 or 7 years. And then by the 7-year mark, you can do a repeat series of 3 in order to get back to where you were prior. Again, we can't stop the aging process, but we can certainly keep it at bay. So, thank you for coming in.
Thank you.
Thank you.